Hello, I am Karen Cole. I am with the Henderson County Health Department. We have recently been awarded the Carolyn Adams Ticket for the Cure grant. One of the ways we have decided to help educate our community about breast cancer is by using the program Know Your Lemons, which uses lemons to show the 12 key symptoms to look out for when conducting a breast self-exam. Even though breast cancer is more common in women, men can also be affected and should also be aware of the symptoms to look out for. Chances are good to survive breast cancer if it is caught in the early stages, with stage 1 having a 99% survival rate and stage 2 a 95% survival rate. Stages are determined by the size of the tumor and the spread of the cancer. Stage 1 has a tumor of 2 centimeters or 3/4 of an inch across, with stage 2 a 2 to 5 centimeters or between 3/4 of an inch and 2 inches. Because these are so small, it is important to self-exam to identify tumors before they grow bigger than this. These are the bumps or the hard lumps to look for in a self-exam. They are the first things to be aware of when you know your lemons. Lumps can be a sign of a tumor, but it could also be the result of a cyst, benign clumps of tissue under the skin, or scar tissue from damage to that area. A doctor can help differentiate between these possibilities. However, mammograms can detect these lumps that may not be able to be felt, so having regular mammograms is important. This necklace shows the average size of tumors that can be found using various exam techniques. The biggest bead shows the likely tumor size found in women who do not regularly self-exam. The third largest is the average size of a tumor that is found by women who monthly self-exam. It is about 1/4 the size of the average tumor in those who do not regularly self-exam. These smaller beads show the average tumor size found in women who have been professionally examined, the smallest showing the average size of a tumor discovered in women who have regular mammograms. The smallest bead can be discovered by a mammogram 1 to 2 years before it can be felt. Women aged 50 to 74 should have mammograms every 2 years. People of other ages should talk to their doctors about how often to get screened, especially if they have a family history of breast cancer. While most breast cancers can be identified by lumps, inflammatory breast cancer, IBC, typically appears as red or hot patches on the breast, a thick area or rough texture like an orange peel. IBC can also cause pain or tenderness, swelling, or dimpling. IBC may also cause an inversion of the nipple, making it look sunken. Dimples in the skin in breast can be caused by tumors pulling the skin. Lifting your arms over your head can more easily show dimples. If you notice a dimple that does not go away when no pressure is applied to it, that is a potential sign of breast cancer. Tumors can also pull in the skin near the nipple, causing it to invert, flatten, or change shape. Crust around the nipple could be caused by eczema or complications with breastfeeding, but it could also be caused by breast cancer called Paget's disease. For this reason, it is important to be vigilant for these changes in skin texture around the nipple. Discharge or new fluid from nipples is normal during times of hormonal change, such as puberty, pregnancy, or breastfeeding. It is also common when there is infection present, such as a cyst. However, if the discharge is clear or contains blood and none of these other changes are responsible for the discharge, it may be a result of breast cancer. Changes in breast size or shape can also occur due to hormonal changes like puberty, pregnancy, breastfeeding, or during your period. However, if these changes are not related to these and do not revert after your period, it may be a sign of breast cancer. Breast cancer in advanced stages can break down the skin of the breast, creating an open wound. These skin sores may have a foul odor or discharge. This is usually accompanied by a lump. If you have this symptom, you should see a doctor as soon as possible. Veins can become more prominent due to weight gain or breastfeeding, but it could also be a sign of a tumor drawing more blood into itself. This will often occur on the breast or near the collarbone. There also may be swelling near the arm with this symptom. If you are a woman between ages 40 and 64 and do not have Medicaid or Medicare Part B, you are eligible to take part in the Illinois Breast and Cervical Cancer Program. If your deductible would cause a significant financial hardship or you are uninsured, you also may have access to the program. This program provides free mammograms, clinical breast exams, and Pap tests to women with a provider of your choice. If you are living in Henderson, Warren, or Knox County, you can make an appointment through the Knox County Health Department by calling 309-344-2224. These services can save a life, so do not hesitate to act.